Mic check, mic check. Okay, ladies and gentlemen, hello. Sorry I'm a little late today. I came back from my doctor's appointment. Everything's fine. Just a routine checkup. Anyway, today what we're going to do is we're going to finish up our little explanation about heart anatomy. And then I'm going to post a second video, except this one was a video I made at the beginning of the school year for my physio class. I know some of you guys are going to be like, oh, why don't you make us a new video for IB year 2? And I thought, well, I could, but I don't see a reason to reinvent the wheel. It's the note I put on your lesson today. So don't be alarmed if you find that it's a little old, but it was filmed in September. So that's the second part of the video. Or rather, I should say that that's the second video I'm going to post for this lesson. Now, let me explain why I'm doing this. I began this unit talking about major organs and their systems, right? But we skipped a very essential part of learning anatomy and physiology. We skipped the part where we learned about the different regions of the body. We also skipped the part where we learned, or where we were supposed to learn about something called anatomical directions. And so what I like to do is I like to stop after this little lesson about heart anatomy and then move backwards in time to do anatomical directions and mapping. Then we're going to fast forward to where we stopped and then continue on with the heart, okay? Because honestly, it's been very difficult to explain things to you guys without the necessary vocabulary. So that's what we're doing. We're going back and then we are resuming where we left off and then moving forward from there. It'll only take a couple lessons for us to do directions and mapping, but it's that important that I wanted to go back. So with that in mind, let's take a look at, where are we? Hold on one second. Here we go. Okay, so what I like to do is show you where we are. At the moment, we're on page 47. We're talking about heart anatomy, and we're just going over the heart vessels, pulmonary veins, pulmonary arteries, et cetera, et cetera. Like I said, I'm going to go backwards in time, and we're going to do the lesson about anatomical directions and mapping on page 41. Okay, so that'll be a little lesson, then we're going to go back to where we were originally. Today, for this part of the video, we're on page 47. I'm going to finish up the explanation really quickly. It shouldn't take me that long. And there you go. So I'm going to stop that share, and I'm going to turn on my camera to finish up where we left off. Okay, so I believe on Zoom, we were right here talking about the blood flow. As a reminder, superior vena cava brings deoxygenated blood, oxygen poor, in other words, oxygen poor blood from the top of the body back into the right atrium. The inferior vena cava does the same thing, except the oxygen poor blood comes from the bottom of the body. And both of these large veins will drain into right atrium. Oxygen poor blood then flows through tricuspid valve, through right ventricle, and from right ventricle past the pulmonary valve, and then through into these vessels here. This vessel on this side we call the right pulmonary artery, and this vessel on this side we call the left pulmonary artery. Again, it was very hard to show you which side's the right and which side's the left because I can't actually use some of the anatomical directions which you guys will learn today. But once you guys have this lesson, then I can start using this vocabulary more fluidly, and then you guys can get used to it. Anyway, pulmonary arteries will go to their respective lungs. The left one will go to the left lung. The right one will go to the right lung. Then the blood is reoxygenated, or it's oxygen rich. Either way you want to think about it, that's great. When blood returns back to the heart, they return through something called the pulmonary veins. So the right pulmonary vein is over here. There are two of them. And then the left pulmonary veins are over here. There are also two of them. So really you're looking at a total of 4 pulmonary veins if you're counting them. 1, 2, 3, 4. I'm going through this a bit fast because we already talked about it last time. All right. We left off with a little bit of a twist here. The twist is that the right pulmonary veins will carry oxygen-rich blood behind the heart into left atrium. So the blood here does not mix with the oxygen poor blood. It has to go behind the heart into left atrium. It's a bit tricky because the pulmonary veins over here kind of look like they're going into right atrium, but I can't draw the heart from the back because it's a two-dimensional picture. So I'm telling it to you guys verbally. Please make sure you know that the right pulmonary veins carry oxygen-rich blood into left atrium. Same with left pulmonary veins. Okay, here's another trick. The other trick is that 99.9% of arteries carry oxygen-rich blood. But the only arteries of the body that carry oxygen-poor blood are the pulmonary arteries. Do you see? Most arteries of the body carry oxygen-rich. The pulmonary arteries do not. They carry oxygen-poor. The same, the reciprocal can be said about the pulmonary veins. Most veins of the body carry oxygen-poor blood, like superior and inferior vena cava. It is only the pulmonary veins that carry oxygen-rich blood. Does that make sense? That's a really neat little trivia question that you guys might want to know. Okay, now the pulmonary veins I haven't yet labeled, so I'm going to label them for you right now. Where are my pens? I'm going to label them in purple. So these here are your left pulmonary veins. This one, this one. And then over here will be your right pulmonary veins. This one and this one. Sorry, it's getting a bit messy. The oxygen-rich blood, which is red, will move past the mitral valve into left ventricle. And from left ventricle, they'll move past the aortic valve into the largest artery of the body, and that's called the aorta. So let's get a ring for aorta. Let's get a ring for left pulmonary veins. And let's get a ring for right pulmonary veins. Usually, I end the heart vessels there because for my physio class, that's enough. But for you guys, because you're IB, I would like to go a little bit farther and tell you what these three vessels are. So just to identify them a bit more clearly, blood can go up here, it can go here, and it can go here, and of course it can go down here to other major arteries. There are a lot of major arteries of the body that I think everybody should know. The femoral artery, the brachial artery, atrioventricular artery, etc. But I really only reserve a few more vocabulary words for this class, because if you guys want to learn more, then you're going to learn more later on in different classes. Anyway, I would like to identify these three arteries to you. Let's start here. Where's my black? These three arteries are really important, super, super important. They are the first branches off of the aorta, which means they supply some of the most important parts of the body. I'm going to name them, and I'm going to tell you what part of the body they supply oxygen-rich blood. This first one is called the brachiocephalic artery. Now that's a big word, so I'm going to zoom in so y'all can really see this. B-R-A-C-O-I-A, I'm sorry, I-O-C-E-P-H-A-L-I-C, brachiocephalic artery. Again, just like with most anatomy, if you break down the word, it's a lot easier to understand. Brachio means arm. Cephalic means head. So what does this artery supply? It supplies the arm and the head. Pretty easy, right? All right, which arm? Since it's on the right side, it supplies the right arm. And head. That's a vocab word. Let's do the second one. The second artery right here is called the carotid. The carotid artery supplies the brain. In fact, it is the carotid artery that is cut when someone slits their throat. The carotid artery is one of the most important arteries of the body because it supplies the brain. So if the brain doesn't get enough blood, then the brain dies. A ring for carotid. And finally, on this side, which is the leftmost of these three branches, is called the subclavian artery. Subclavian, we've seen this root before. Sub means below, like a submarine. So a submarine is below the water. Subclavian means below. The clavian means the clavicle, which is this bone, the collarbone right here. So the subclavian artery goes below the collarbone and supplies the left arm. Brachiocephalic, carotid artery, and then subclavian artery. B, C, S. Brachiocephalic, carotid artery, subclavian. Do you guys know what BCS stands for in college football? You guys are like a year away from college. Bowl Championship Series. That's how I remember it because I'm really into American football. Or at least I used to be really into American football before all that concussion stuff. So the blood will then move past the BCS arteries, and then you have here the descending aorta. And descending aorta goes to all different kinds of other arteries. So like I said, this is all kind of bonus material, but I think it's fun to learn because you learn other arteries besides the aorta and the pulmonary arteries. You have maybe a dozen different major arteries of the body, and they're all really important to know, and they all have names. So let's summarize. We started this whole thing by saying 4 chambers, 4 valves, right? And we said that, well, that's a good start. Here are the chambers, here are the valves, but let's complicate things a little bit and talk about now the vessels of the blood, of the heart, and then how the blood flows through the heart in order. Then I said, well, let's talk about some other arteries after the aorta, especially the really important ones like the brachiocephalic, carotid arteries, and the subclavian arteries. All of those arteries are really important to supply different parts of the body above the heart. Okay. There are a couple more that I like to identify that I almost forgot about. I'm going to give the myocard. Oh, I just gave it away. I'm going to give the ventricles a bit more meat to them because they have way more myocardium than the atria. They're more muscular. Myocardium, heart muscle, walls. One of the thickest regions of the heart is the myocardium between the two ventricles, which is here in black. This is called the interventricular septum. Inter means between, ventricular means ventricles, septum means a separator. And that, ladies and gentlemen, is a little bit about heart anatomy. So let's finish up this explanation. Again, I would like you guys to do anatomical directions and mapping so that we can move forward with some of our discussions of other organs. There's really no point in my view, there's really no point in learning different parts individually. We have to learn them all as a whole and how they work together. And part of that whole means knowing your body. So I'm going to stop that share and I'm going to post this little video for you guys to see. And then I'm going to have you guys do the other assignment. So again, the video you're going to see will be something filmed from September or August or something like that. So don't be alarmed if my hair is different and my clothing's different. So anyway, miss you guys.